Oh shoot, you tweaked your back. What are we going to do about this? First of all, don't panic. Breathe. It's okay. This will get better. Let's slowly get to the ground here, just like this, and try to do just a few prone belly breaths. Prop your head up on your wrist, just like that. Sit here and take nice, big, deep breaths. Just breathe into your belly. Try to relax everything. After a few repetitions, maybe a couple minutes, prop yourself up onto your elbows here. Same thing. Couple breaths, breathe into your belly, try to relax. Now let's do some PLEP'S, or prone lumbar extension presses, or Mackenzie extension presses. Let's just try this, see how it goes. I know, most of you are probably like, dude, no way. When my back's tweaked, I'm not even gonna be able to do that. Trust me, you will be able to do that. Movement is medicine, motion is lotion. Getting into this position and slowly telling your body, breathing into that soreness or that stiffness and telling your body that it's okay to move is going to decrease a ton of the splinting and the emergency situation that's going to happen there, and that's going to get you on the road to recovery much quicker. Now, if any of these extension presses make your symptoms worse, or like pain is going down your leg and it's going further down your leg and it's getting hot and searing and sore, then just stop and sit on a chair and flex your body forward repetitively a few times and just see what that does. If the symptoms aren't getting tremendously worse, you're on the right track to minimizing this thing and not making it a whole ordeal. Okay, so we're gonna keep going here. So, okay, we did maybe 10, 15 of those, maybe a couple sets. Now we're gonna get up to our feet just like that. Using your hips, push your hips through, hip thrust through, and we're gonna try some lateral bends, some side glides. Oh, we found that that's the hot spot right there. So that's the painful side. We're gonna put the painful side out away from the wall. Now, actually, I did this backwards, or I guess I progressed too quick. So this is the progression. This is what you would do after the next exercise, but you're just gonna try some minor side glides to try to induce some motion. This is the first way to do it. So this is a regression. This is a little easier. So I'm gonna lean into the wall, and I'm just gonna slowly sink my hips down towards the wall and try to get some right-sided lateral flexion here. Then I would go back to the initial one I did. Ooh, look at that. Now we've got a little better range of motion. Sure, it's still probably tight. It's still probably tightening up, but we're doing okay. So we're progressing. Now we're going to do some standing extensions. So we were just doing them on the floor. Now we're going to do some standing extensions, maybe 10, 15 of these, maybe a couple sets. I sped the video up just so we didn't, waste all day here. But you can see if I lean my head back, that increases the extension like crazy. So I would start with my head forward and then progress to this. Do maybe 10, 15 of each. And then we're probably on the road to getting quite a bit better here. So now we're just gonna do some CAT-CAMELs. Let's do maybe 10 or 15 CAT-CAMELs, emphasizing that arching of the back a little bit, just to breathe into it, let that belly sag. We're really just trying to induce extension and make sure all those muscles aren't really splinting like crazy. All right, now we're gonna advance even into some like advanced PLEP'S, where we're gonna kind of go from a CAT-CAMEL position down into a PLEP, or a prone lumbar extension press. And we're gonna go back and forth, and we're just gonna kind of work this thing out. Movement is medicine, guys. You gotta try to get it moving fast. I just want to see if I can do that again. Hey, you got to get it moving fast, okay? So don't be afraid to do like 10, 15 reps. I would try to shoot for 2 sets of 10 to 15 reps of every single position that I showed you there, okay? So like I said, movement's medicine. If you're really starting to tighten up, this is common. It's going to tighten up. The muscles have to kind of splint and spasm and kind of run their course, but they don't always have to last forever, okay? And if just panicking makes everything worse, okay? So continue to do this. Like I would do it every couple hours for the next couple days. Ice is your friend. I know there's a lot of controversy around ice right now, but ice can be your friend for pain reduction. And then because of pain reduction, maybe you can induce more motion, okay? The motion is gonna be the consistent thing that's going to help you, okay? Now, of course, if you have any kind of red flags like saddle paresthesia or, incontinence or anything like that, go get it checked out. But most of the time, these things are gonna take a few days to get over. Sometimes they can last maybe a week or so. I adjust people in this situation. It's the movement, the motion that's going to kickstart the healing and the recovery the fastest. The quicker your body feels safe to move, the faster you're going to recover. All right? I hope that helps.